Hey there. So, 2026. On New Year's Day, pretty much every morning news show had a not so good news story ready to go.
This morning, more than 20 million Americans
will see health care premiums double, triple, or go even higher
after Congress failed to extend certain subsidies under the Affordable Care Act.
A lot of people will end up without insurance, or with much crappier insurance because they can't afford anything better, or paying a lot more for insurance than they can afford, or some combo platter. And because employer plans got more expensive too, and a bunch of employers weren't ready to pay more, lots of folks ended up with insurance from work that leaves them on the hook for more. So all of it leaves a lot more people a lot more vulnerable this year to overwhelming bills for insurance premiums, for medical care, for medicine. So I thought it would be a good time to check in with one of the people who has given me the most inspiration and has taught me the most about how we can push back against some of this. That would be Jared Walker, the founder of the nonprofit $4. I first talked with Jared 5 years ago, right after he went super viral on TikTok, sharing a secret that was hiding in plain sight.
Most hospitals in America are nonprofits, which means they have to have financial assistance or charity care policies. This is going to sound weird, but what that means is that if you make under a certain amount of money, the hospital legally has to forgive your medical bills.
And millions of people kept watching as Jared quickly demonstrated how to apply and then wrapped up with an offer.
I run a nonprofit that does this, so DM me and I will actually do it for you. Let's see if we can crush those medical bills.
Here's what Jared said to me a couple weeks later about that offer.
Yeah, that really backfired. No.
Thousands of people had gotten in touch to take him up on his offer, and $4, a super tiny nonprofit that Jared had started to help people in his hometown of Portland, Oregon, well, it suddenly had a bigger national mission that Jared was scrambling to meet.
I'm excited. We're going to help a lot of people, and hopefully we can get some funding to scale what we're doing because shit's wild.
And it has been wild ever since. Talking with Jared over the last 5 years and watching the $4 team scale up their ambitions and impact, it has been one of the most inspiring and eye-opening stories I've ever seen. So I was excited to talk with Jared a little after New Year's to hear how things were looking to him for 2026. I'd already seen the numbers from the past year. They helped people wipe out $55 million worth of hospital bills in 2025, a huge increase from the year before.
As far as impact goes, what we were able to do with the money that we raised, we're rolling. $4 is killing it.
So I was a little surprised when Jared said 2025 had been tough.
We started the year with two of our biggest donors basically just backing out.
Yeah, some of the Trump administration's early disruptive moves, like trashing foreign aid, that had led those donors to rethink their priorities. $4 lost $500,000, almost a third of their budget. Suddenly, Jared found himself scrambling to replace it.
Just trying to make up that $500,000 gap was fun.
Oh my gosh. He managed to make up about $200,000, and he says $4 didn't lay anybody off, but some people went to half time. And as the year went on, more political news forced Jared and $4 to rethink their strategy for 2025. It was another scramble. And meanwhile, $4 kept setting new records. They wiped out 2/3 more medical debt than the year before. All of it left Jared and his colleagues thinking hard about how they chart their path in this world that's still changing really fast. The story of where they've been in the last year and what they've done across the last 5 years, it continues to help me think about the big picture like nothing else. So it's a great place for this show to kick off 2026. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter, and I like a challenge. So the job we've chosen on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you a show that's entertaining, empowering, and useful. And just to go back to the beginning for a minute, when I first talked with Jared 5 years ago, He was already looking at the big picture, how big a difference it would make if more people actually got the charity care they qualified for. Here he is in January 2021.
We've had millions of people now that have declared bankruptcy over medical bills that they legally didn't even have to pay if they knew about this. And that should upset people.
And this is one reason I find $4 so compelling, along with their scrappy approach and their accomplishments. From the start, they've always made the scope and the stakes of our healthcare system's dysfunction so clear, so stark. But talk about scrappy. When I had that first talk with Jared, he was scrambling to respond to the messages that were pouring in, thousands of them. And he was grabbing whoever he could for help.
My niece is like 16. I was like, yo, here's my credentials. Get on here and start replying to people.
Then, by the time I talked with him just a few months later, in the summer of 2021, he had taken incredible steps to start scaling up $4 with help from dozens of volunteers, including, especially, folks who had heard about him on this show.
I was just shocked at how many people were reaching out saying, I heard you on this podcast. I heard you. And I'm like, well, I've only been on one podcast, so I know it's this one.
Honestly, this is another part of what makes $4 my favorite story, because it shows how many people are ready to jump in and help and how much people are ready to contribute. In just a few months, Jared and a volunteer army, including generals, a couple of wildly qualified folks who put in close to full-time hours for a while, had done something incredible. They had built $4 a website where anyone, anywhere in the country, could check to see if they qualified for financial assistance and ask for help applying. And because every hospital sets its own criteria for who qualifies, setting up that system meant grabbing charity care policies from more than 2,000 different hospitals and coding all of those criteria into a database. The website with that database went live in the summer of 2021, less than 6 months after Jared first went viral on TikTok. And he and his colleagues have been building and refining their operation ever since, and working toward making a big picture difference. Last time I checked in with Jared, it was late 2024. $4 had put out a couple of research reports estimating the size of that big picture. They found that less than a third of people who qualified for charity care actually got their bills forgiven. And if all of those people actually got the charity care they qualified for, $4 found that would mean $14 billion in hospital bills, in medical debt, would vanish. $14 billion that hospitals could be forgiving under their own policies every year. And Jared definitely noticed that number, $14 billion, it dwarfed the amounts $4 was able to address working case by case. Like, they were closing in on clearing $32 million in hospital bills that year, which is a lot for a tiny organization. But Jared was like,
it sounds great. And then you see the 14 billion number and you're like, oh, shoot. What are we doing? What are we doing?
Jared and his colleagues had started a strategic planning process that was going to lead them to say, let's focus on making a dent in that $14 billion by advocating for new policies, like laws to make sure hospitals at least check to see if people are eligible for charity care before, chasing them for bills they can't pay. And while they were planning, the ground beneath them started to shift. The Trump administration took office and, among other things, immediately started slashing foreign aid.
President Trump says he wants USAID, the relief agency helping millions of people around the world, to be shut down.
Just yesterday, USAID employees in Washington were told to stay home.
Jared says some of his donors reset their priorities to fill in gaps internationally. One of them finalized their decision just as $4 was wrapping up their first board meeting of 2025.
I get this email from our biggest donor saying, hey, we're going to cut the $300K.
Oh, my gosh. Oh, wow.
And my board chair goes, Jared, what happened to your face? Is everything okay? And I was like, am I going to tell my whole board right here, right now, that we just lost our biggest funder?
I asked Jared later by email, hey, did you spill the beans then? His response, LOL, I did not tell them in that moment. My thought process was, I don't want to end our first board meeting of the year with this bomb. We are all hyped on the new year. let's keep that energy. The board can't change this email. So Jared filled them in later and started hustling to fill the budget gap. They kept working on their strategic plan through those first few months of 2025. And by the spring, they were putting finishing touches on it. And then the news cycle intervened again.
We went into 2025 with this idea of we are going to do more policy work. We're going to push more policy. We're going to advocate for better charity care laws. And then Medicaid cuts, right? And then
the Trump administration's big legislative proposal, the One Big Beautiful Bill, aimed to offset tax cuts in part with big cuts to Medicaid spending.
Republicans are looking to slash $2 trillion with a T in long-term spending, and Medicaid could be a target.
And a ton of those Medicaid dollars go to hospitals.
And when you are getting every single headline is, woe is me, we're a hospital, we're not going to make it, you're going to bankrupt hospitals.
That was going to make pushing new rules for hospitals, forcing them to be more generous, a tougher sell. And here's where these two stories. One, $4 gets hit by big, fast-moving changes in 2025. And two, $4 wipes out a lot more medical debt than ever before in 2025. Well, we're going to see where they intersect. That's coming right up. This episode of An Arm and a Leg is a co-production of Public Road Productions and KFF Health News. That's a nonprofit newsroom covering health issues in America. Their journalists are incredible, win all kinds of awards every year. We're honored to work with them. With all of these big picture changes happening, like cuts to Medicaid, $4 decided to pivot.
We kind of slowed down and said, okay, if people are going to lose Medicaid, if their insurance premiums are going to go up, if all these things, what we need to do is we need to double down on direct service and help as many patients as we can, because the appetite for policy change might not be there.
They had a communications and marketing team who had planned to spend the year pushing $4's policy message. Instead, they focused on spreading the word about charity care and $4, pitching Jared to reporters. And it worked. He says he was featured in more than 90 news stories before the year was out.
I was on more podcasts than I've ever been on, ever, doing local news stuff. So the marketing team was cooking pretty good as far as getting the word out.
And that meant more folks coming to $4 looking for help with charity care, which is one thing that drove up the number of people $4 was able to help. The other was the payoff on a long-term investment. In the spring of last year, they finished a project they'd been working on for a long time, making it easy for patients to fill out a charity care application directly on $4's website.
Patient goes to $4.org, they fill out household size, income, what hospital. It tells them if they're eligible. If they are, it bounces them right into a digital application. They can do that on their phone, tablet, computer. They're filling it out, and it is automatically mapping their data into the correct hospital form.
Yeah, this is the big upgrade. I don't have to follow a link to the hospital's website and fill out their form. I don't have to print anything out. I'm staying on $4's user-friendly site, answering questions from my hospital's application form, because every hospital's form is different, and some ask for more information than others. So the back-end work by $4 to give me the right questions here, that is a big deal. And here on their site, the $4 team is presenting those questions to me in plain, user-friendly English, which not every hospital form necessarily does. And if I get stuck, I message the $4 team to get help directly. When I'm done, it shows me the results and says,
here's your completed application. Does everything look good? They thumbs up it. We submit it to the hospital. And then we do follow-up from there.
Jared says they also created a portal where patients can check on the status of their application, jump right into a chat with a patient advocate. I was like, this is all pretty impressive. Your year did not totally suck.
Yeah, it is honestly you're reminding me of, I'm like, oh yeah, we did some really cool stuff last year.
And he sees room for new tech to help them get even more efficient. Yes, with help from AI.
We're very much in the camp of this is a great tool. It's not going to solve all of our problems.
But he does see a few areas where it could help, including helping his team do something they actually haven't had the capacity, like the time, to do yet. Do a little quality control on the documents patients submit with their applications, like proof of income.
Sometimes people accidentally upload a picture of their cat instead of their, W-2 or whatever. So if we could have an AI tool scan the document and make sure that it matches with what they said.
And flag situations where, a human being from $4 should take a look before sending it in.
That would also save us a bunch of back and forth with the hospital and the patient.
In other words, save time for everyone and maybe help $4's reputation with hospitals.
It kind of makes us look bad if we send documents to a hospital and it's a photo of somebody's cat,
So doing all this will cost money. Jared estimates like $250,000, including the cost of adding $4's first full-time CTO. But meanwhile, they haven't stopped pushing for policy change. In 2025, $4 published a study that kind of turned the telescope around on the question it had addressed the year before. If hospitals gave financial assistance to everyone who qualified, they had found it would save patients $14 billion a year. So this time they asked, how much of a hit would that $14 billion be to the bottom line for America's hospitals? How much of their income would they be losing? $4's answer, 0.7%.
This is like a fraction of what these hospitals bring in.
Not all hospitals, as Jared is quick to note.
There's 8,000 hospitals in America, and they're not all equal. They're big hospitals, they're small hospitals. Obviously, it's very hard to, generalize these things.
Like we've talked about here before, some hospitals, a lot of them, really are on the verge of going under. And some, more than you'd think, have profit margins of more than 30%. And there's everything in between. But here's the number that really jumped out at me from that $4 report. It's not just that the amount of charity care hospitals withhold is basically tiny compared to their overall revenue. The total amount of income that hospitals get directly from patients' pockets, all the bills I hear about, all that we know are out there, the bills that drive people into debt, into bankruptcy, all of that money, all that suffering, represents just 2.5% of what hospitals get paid for care. That's according to KFF data that $4 cites. 2.5%. I don't have a really deep insight here, but this number just jolts me back to awareness of how big this healthcare industrial complex is and how much its dysfunction costs our whole society. Zoom out. We spend $5 trillion a year on this stuff, and so many people still don't get the healthcare they need. It reminds me that along with understanding ways we can help ourselves and each other, individual, day-to-day ways, it's important to understand why healthcare costs so freaking much, where all that money goes, and what we can maybe do about it. Meanwhile, back to Jared and how he sees things going in 2026.
Healthcare is going to get worse. Healthcare is going to be more unaffordable than it was. Healthcare is going to put more people into bankruptcy, more people into a bad financial situation.
Which makes the need for $4's work more obvious. $4 isn't in danger of going away. But all of the rapid change in the last year, the accomplishments and the setbacks, it's all got Jared thinking hard about how to keep moving forward over the long haul.
$4 has just been so scrappy. We've just been so scrappy. I don't want to be the unpaid intern organization that's just burning everybody out. I want to be able to pay people well. I want to be able to provide incredible healthcare benefits. I want to be able to have a 401k match. I want people to thrive at $4.
Because that's how you make sure people can stick around and keep growing and keep figuring out how to make the biggest impact in a wild environment. As we wound up our conversation, I wanted to tell Jared about how An Arm and a Leg's 2025 had gone, partly because I thought it might cheer him up a little bit. So I told him about how a medical student named Thomas Sanford had put together a resource guide for patients based on our reporting and started handing it out. How other listeners had been helping refine it. How we'd put a version on our website, prompted by Thomas's idea that healthcare workers could decorate the badge reels on their lanyards with a QR code patients could scan.
Yeah, putting it on the lanyard. I love it. And it's just something that we need more of, is like, how do we empower the patient and the healthcare worker and the people that are, up to fight it?
That's it right there. The place we're in right now, just with healthcare, the big picture can look really scary. Trying to take on the whole thing. Heck, just trying to take in the whole thing. The big picture, it's a lot. And it doesn't mean we stop trying. But we're not individually responsible for fixing the whole thing right away. And we can find things to do, ways to help ourselves and each other in the meantime. Like by using the kinds of things we learn here to take a little more control over our own lives and helping other people take control over theirs. We spent a lot of the last couple of months asking you to help us keep doing our work, and you really came through. And a lot of you included notes with your donations, incredible, really heartening notes. And I'm going to share one here. We actually shared it in the First Aid Kit newsletter last week, but I'm repeating it here because it illustrates something. Here's what it said. This amount, $85.23, is the amount I avoided paying because you taught me how to take notes when speaking to my insurance company, always getting the name of the representative and the call reference number. And here's what I take from that. Every time any of us gets back a little capacity, saves a little money, saves some worry from a system that threatens to overwhelm us, that is capacity we can put to use, to nourish ourselves and each other, to bank some new strength. And things that seem small, saving $85, telling one person about $4, helping them connect to charity care, there is no way to know that they're going to add up to enough to move ourselves toward the structural change we need. But every bit truly does count. So, thank you again for listening, for sharing what you know. I learned about $4 because listeners to this show saw Jared's TikTok and made sure I saw it. And for doing what you can for yourself and your family and the people around you. We'll have a new episode for you in a few weeks. Till then, take care of yourself. This episode of An Arm and a Leg was produced by me, Dan Weissman, with help from Emily Pisacreta, and edited by Ellen Weiss. Adam Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Claire Davenport is our engagement producer. Sarah Balama is our operations manager. B. Bosco is our consulting director of operations. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. An Arm and a Leg is distributed by KUOW, Seattle's NPR news station. Thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. Finally, thank you to everybody who supports this show financially. You can join in anytime at armandalegshow.com/support. And now, here are the names of some of the folks who chipped in to support us in the last few weeks of 2025. Thanks this time to Austin Kelm, Winnie Makawa, Carl Hersey, Perseverance Gijima, Alan Dixon, Austin Kelm, Brackets Kaplan, Todd Kerwan, Hal Schlanger, Jupiter Johnson, Richard Hennigan, Arden Clemmer, Gina Upchurch, Edward Heaton, Jay Shefsky, Daniel Carnice, Francisco O'Houston, Gray Hilliard, David Ray, Sean Hecht, Barbara Cuneo, Gray Pritchard, Diane, Joan Allen, J and Z, Lee Rye, Rona Peterzak, Dr. Stephen Whitfield, Corey Doctorow, Adam Schwartz, Ushwini Hardiker, Evie Keenis, Vivian Ho, Linda Powell, Meredith Beck, Scott Gurian, Michael Barrett, David Hutton, Teresa Sterling, Laura Michaels, Steve Whiting, Jim Justgo, Vlad Ribble, Sue King, Luis Manriquez, Tom McDougall, Stephanie Lee, and Kennedy Patlin. Thank you so much. Emily has a health insurance card from an arm and a leg, thanks to you and so many people. Thank you so much. Happy 2026 for whatever we get from it. Catch you soon.